In this lecture, we'll deal with false positive, false negative, and atypical or uncertain diagnosis in prostate pathology, three different topics that comprise important traps to avoid in prostate pathology. First, we'll deal with false positives or benign mimickers of prostatic adenocarcinoma, and I hope this helps you increase the diagnostic accuracy in recognizing and correctly diagnosing benign cancer mimickers or distinguishing the imposters from the real thing. And the first topic is well covered in this paper that I've published recently of benign mimickers of prostatic adenocarcinoma, which represent false positive scenarios. And this paper is part of a supplement of Modern Pathology of January 2018, which also includes other contemporary contributions covering relevant topics of prostate pathology that followed after the long course at the USCAP in 2017. Benign mimics of prostate cancer may represent parts of normal anatomy, as illustrated here, atrophy, or other processes such as benign proliferations, hyperplastic processes, metaplastic processes, or inflammatory processes. Benign mimickers can be located within the prostate, and the ones that are located within the prostate are listed here, or they can be found outside or at the periphery of the prostate, and the ones that are typically found outside are listed in this slide. The most common mimics are the atrophy and its variants, adenosis or atypical adenomatous hyperplasia, basal cell hyperplasia, or, for instance, benign glands mimicking perineal invasion. However, very often, benign crowded glands that are normal prostatic glands, but because of their crowded architecture, may represent a significant portion of the mimics of prostatic adenocarcinoma. Different mimics of prostatic adenocarcinoma can resemble different patterns of cancer. For instance, pattern 3 cancer, where one sees individual and well-formed glands, all small acinar proliferation. Some of them can demonstrate similarities to pattern 4 cancer with cribriforming or fused or poorly formed glandular formations, or pattern 5 cancer, where one sees typically solid or individual cells, non-glandular differentiation type proliferations. Most commonly, the cancer mimics pattern 3 cancer. However, there are some mimics that mimic pattern 4 and pattern 5 cancer, and we'll follow generally this outline in our presentation. We'll start with the mimickers of pattern